Welcome back. This is Sleep Better TV. I'm Scott Drake. We continue our discussion with Dr. Larry Pribyl. He practices in Independence, Missouri with the Center for TMJ and Sleep Apnea. We're talking about sleep breathing disorders in these discussions, and this one, pediatric sleep breathing disorders. Dr. Pribyl, at what age can a child develop sleep apnea?
A child can develop sleep apnea at any age. There are babies in children's hospitals that have sleep apnea, are born with it, and it's there from the beginning of their life. And so there are no minimum age limits that need to be met before apnea can be part of one's life.
So if a parent hears a child snoring or they stop breathing during the night, what's the first thing they should do?
Well, if they observe those things, one of the first things I would tell them to do is go to their primary care physician, go to their pediatrician, go to an ENT to have the child evaluated, have their airway evaluated, check their tonsils and adenoids, which for children is usually the first line of attack in evaluating those, and then going down the healthcare chain for other issues if need be. But tonsils and adenoids are the first point of what needs to be looked at. But if there are breathing issues, the child needs to have that dealt with as soon as possible.
How old does a child need to be before they can have a sleep study?
A sleep study can be done on anyone. Children's hospitals are very, very good with working with kids, working with the families to get that done. And that diagnosis for a child, if they exhibit signs of cessation of breathing or have issues with potential apnea issues, it's very, very important that they get tested as soon as they possibly can.
So finally, doctor, is snoring or any teeth grinding normal in a growing, developing child?
Snoring and tooth grinding both are not normal and are usually signs of an underlying problem, whether it's large tonsils and adenoids, whether it's a compromised airway, whether it's a jaw joint TMJ issue. Those things need to be dealt with, and you need to do the proper evaluation and diagnosis in order to come up with the proper solution for the child.
Dr. Pribyl, thank you again.
Thank you.
My guest has been Dr. Larry Pribyl with the Center for TMJ and Sleep Apnea in Independence, Missouri. And you're watching Sleep Better TV.